This topic is pure gold for your studies. Today we're breaking down BNF Chapter 1, Part 6, Gastro-intestinal Smooth Muscle Spasm, step by step so it's super easy to understand. Let's quickly understand what gastrointestinal smooth muscle spasm really is in the easiest way. Gastrointestinal smooth muscle spasm simply means the muscles in your stomach or intestines tighten suddenly and involuntarily. This sudden contraction causes sharp, crampy abdominal pain. It usually happens when the gut becomes overstimulated by stress, certain foods, infections, or irritation from medicines like NSAIDs. The key point is the smooth muscles contract too strongly or too quickly, and that creates the painful spasm. When we talk about gastrointestinal smooth muscle spasm, the main treatment that comes to mind is antispasmodics. Now let's understand them step by step. Antispasmodics are medicines used to relax the muscles of the GI tract and reduce cramping. BNF divides them into two main groups. 1. Antimuscarinics. 2. Direct smooth muscle relaxants. Let's break each one simply. Antimuscarinics. They were previously called anticholinergics. What do? They reduce intestinal motility, meaning they slow down the movement of the gut. This helps control smooth muscle spasm and pain. Examples: tertiary amines, atropine sulfate, dicycloverine hydrochloride, also called dicyclamine, quaternary ammonium compounds, Propantheline bromide, Hyoscine butylbromide, Buscopan. Why two types? Simple explanation. Tertiary amines, more lipid-soluble, can cross the blood-brain barrier, so they have a higher risk of central nervous system side effects. Quaternary compounds, less lipid-soluble, do not cross the brain barrier easily, cause fewer central nervous system effects, also absorb less from the GI tract, so their action stays mostly in the gut. Special notes. Dicycloverine has weaker antimuscarinic action than atropine, may also act directly on smooth muscle, dual action. Hyoscine butylbromide, used widely as a GI antispasmodic, poorly absorbed, stays local in the gut and good for cramping pain. Okay, next group is direct-acting smooth muscle relaxants. These do not work through antimuscarinic activity. Instead, they act directly on the muscle to reduce spasm. Examples: Alverine citrate, Mebeverine hydrochloride, Peppermint oil. Why are they used? They relax intestinal smooth muscle, reduce abdominal pain and spasm, especially useful in irritable bowel syndrome, IBS. That's our short note for today. Keep it simple, don't overthink, just understand the key points. Next video, we'll break down liver disorders and related conditions in the same easy style. And make sure to like, share, and subscribe for more.